Okay. Welcome back. We've got a very, very great guest ready to join us today, Valentin back on. Here he is. You can introduce yourself, brother. How are you?
Hi, good evening. Well, I'm Valentin from Belgium, Ghent. Yeah, I've been a dentist since 2013 now. And I love doing the restorative works, direct and indirect. I rather do most just small cases, not the real big DSD things and stuff like that, just the things you see in a regular practice. And so, yeah, I see all the normal stuff like you guys do. And so I think we'll have a nice chat about some of these cases.
Yeah, we've got a couple of cases to show the guys, so you guys can see one of them on screen right now, the first case that we're going to look at. And then there's a second case, which is this one here that we're going to look at as well. And did you manage to get hold of the graphs? It doesn't matter if we didn't, but that's what we've got to look at today, guys. So let's shall we have a look at the first photograph, and then we can discuss around what's going on. There we go. Yeah. So whereabouts in Belgium are you from? Just before we just to get to know you a little bit before we start talking teeth.
I'm from Ghent, which is not very central. It's in the Dutch-speaking part.
Yeah.
It's quite a historical city. Yeah, I love the city. I can say to anyone to just come over, have a look, drink a beer. Cheers.
What time's 8 p.m. for you?
Yeah, it's 8 p.m. here.
Yeah. Yeah, so great. And for a few years, and you kind of like these. It's biomimetic stuff, biomimetic dentistry, really.
I am very much inspired by the biomimetic dentistry, although I think it's what I do is not always 100% fully biomimetic, because I like to simplify a lot of the steps. I always think about simplifying my life, simplifying others people's lives, because I'm asked also to make protocols for courses and stuff like that. And so I'm always looking to simplify some steps without losing too much of strength, without losing any good stuff, you know. And so I think the most difficult parts are isolation and adhesion, and that's in that part. And so isolation, I think it should be perfect all of the time, and I think there's some really easy tricks to get to that. But adhesion can be very, very complicated in so many ways. And I think if you don't fully understand the whole process of adhesion, which is quite difficult to understand for a lot of the dentists, general dentists out there, then you can make more mistakes than you can do good steps. So, for example, there I try to use a universal adhesive, but I add some other steps to make the adhesion stronger.
Yeah, we'll talk about that. So should we have a look at this case, that the first one that we decided to look at? What was happening with this patient?
Well, this patient is a female in her younger 50s, and she's been coming to our practice for quite a while actually, but she's always been holding back on doing large restorations, always just wanted to fix what's broken. And nowadays I'm a bit more, how to say, straight on to my patients and saying that, okay, this restoration at this moment, it's not going to hold anymore. It's really just going too far. It's leaking. At some point, the tooth is going to break. And so this patient gained trust in me over the years. And at this point, she said, okay, let's do the restoration and let's go for an indirect ceramic restoration. And so obviously, as you see in this picture, there's leakage all over the place. There's a big gap in between of the amalgam. We fixed it already 2-3 times with some composites, so it's just a puzzle of different restorations.
So we move on to the second picture. You can see an amalgam. I think it's maybe a composite or a GI. You use Kerry's dye.
Yeah. So I've been using Kerry's detector dye now for quite some while because when I started to use it, I really saw that even though I'm using magnification and even though I was always very careful, when using the Kerry's detector dye, I saw that somehow some caries was still left there. So yeah, really weird, and so intrigued me. And this is actually the first picture or the first time after I thought I took everything away with magnification, with microscope magnification. So it's very intriguing how much of the really caries affected part you really don't take away if just using your vision.
And for those guys who haven't used Kerry's detector dye before, what are you looking for when you've dyed the tooth? Is it the very reddest bit to remove?
Well, basically anything that stains will be some tissue you want to remove, unless it is out of the peripheral seal zone. So the peripheral seal zone is the zone, the utmost outer part, the utmost 1 to 2 millimeters of your preparation. You want it to have very clean. So you want it to have spotless, no pink or red spots anymore, like that. But in the middle, where you have the pulp chamber, there you want to be very careful. And actually the rule that has been set is just to stay away about 5 millimeters from the occlusal plane and 3 millimeters from the marginal borders. So if you get too close, so inside of these 5 and 3 millimeters, then you just have to stop excavating, even though if it's still pink or red.
Yeah, you don't want to cause an exposure. Chico, is it sounding a bit better now? I just took my phone off the stand. I think it was echoing as a result. So yeah, so then you've been careful around the pulp because we don't want exposure. We don't want to make endos when we can avoid an endo. So then from this point, what are you looking at in terms of planning your prep?
Well, here actually, all I did was just remove all of the debris, all of the old restorations, and all of the caries that needs to be taken away. And then also we see some cracks.
Yeah.
Now for the cracks, they have to be clean as well, as deep as possible, especially in that peripheral seal zone. But if you go too deep, you get another complication, which is again the isolation. So for me, if it looks like this, which is clean, closed cracks, then I leave them. I won't go chasing them any further because you don't know where to stop at some point.
Yeah.
And then, of course, we go looking at weakened cusps. And here, I think it's close to say that there is no cusp left. And if there was any cusp left, under 2 millimeters thickness, I would just reduce it by 1.5 to 2 millimeters.
Yeah, awesome. And we can see you've done some floss ties as well there to get a little deeper, haven't you?
Yeah. So you can see at the mesiolingual that in the past where the cusp broke off, it broke off quite in a diagonal way.
Yeah.
And so that's actually the deepest part of the preparation. And to get that isolated, I use the floss tie over there.
Yeah. And do you pack cord as well?
I don't pack cord. If I pack anything, it will be Teflon.
Okay.
PFDE tape, but I rarely use cord.
Yeah, and then you've done the prep here, so we can see the photograph of the prep as well, which is looking really clean. What's your philosophy with terms of retention? Obviously, we know we haven't got a lot of tooth left there. What are you trying to achieve to make sure, or to try and help the tooths, the restoration stay as long as possible? Or do you rely on the bonding?
I fully rely on the bonding. So here it's a completely non-retentive prep.
Yeah.
I just added some composite to get the hollow out of it and to support any of the remaining standing walls. But I'm not going to make a whole crown build-up to have some more retention. I'm just going to rely on the adhesion of the adhesive system that we're going to use while luting the ceramic.
Yeah, yeah. And are you using when you're doing your impressions, is it digital or are you using traditional stuff?
I have a digital impression scanner, but it's a really low quality one.
Right.
So it's not gonna be something you're gonna do large partial fixed dentures with or anything. And sometimes I see with that scanner that if the margins are too close to the gums, that it's really difficult for it to like separate gum from tooth. And okay, you could always try to put a better cord and do a double cord technique and stuff like that. But if it gets too difficult, then I usually go to the normal conventional way of impressioning. But I always try to do it digital.
Yeah, yeah. It's coming into more of a fashion now to use the digital. So I generally ask guys what they're using and what their thoughts are. But I think a lot of people like to scan. We like our little gadgets, don't we?
Yeah, of course. But it's really a very nice workflow, and I think that about 95% of my work now is fully digital. But I still use I still use the paste as well in more difficult or more deep cases. I think you still can throw it away.
Yeah. It's there just in case the battery runs out or something, power cut. Who knows?
Indeed, or it's updating or something like that.
Yeah. And this is your temporary for this particular case, isn't it?
Yeah. So I rarely go make full temporary crowns anymore because of the retention problem. If we'd make a classical provisional here, then it would fall off the day itself or the day after.
Yeah.
So since we've done a good immediate dent and sealing, there will be no sensitivity. There's no way the tooth will be harmed or any caries or something like that will be activated. So what I usually do is just put 3 or 4 of these little liquid dam tags just to keep the tooth in place. And maybe in the 2 to 3 weeks waiting time I have with my lab, 1 or 2 will go away, but mostly it stays well put in there.
Yeah, so you're just trying to make sure it doesn't over erupt or something like that. Yeah.
Yeah, it's not going to over erupt, or it's not going to, like, most of the time you have the most distal tooth that's going to mesialize into the space, and then your onlay or overlay won't fit. So that's pretty simple.
It's a bit of a ball ache, isn't it? I think that's the technical term for when that happens. But yeah, this was mainly that case, and I thought it was a nice one because it shows kind of a few different steps of the preparation stage. What do you tend to do pre-op? You know, all the way right at the start, if we're thinking about occlusion, or is this going to be a good one for an onlay? Is there anything that you tend to look at?
You mean before you start prepping?
Yeah, before you start prepping, because sometimes you're thinking, well, you know, we haven't got a lot of retention form with a tooth like this, you know, with lots of big fillings. So is there anything that you ever do some sort of adjustment to the opposing tooth if it's got a, you know, deep cusp or something?
Well, sometimes, of course, like in this case where you have a very old restoration, sometimes it can be more worn out or even a lot lower. And so you have some over eruption of the upper occluding tooth. And then it can be necessary to adapt something. Or we have a look at it, and it also needs an overlay in a lot of cases. Or sometimes it has a very sharp palatal cusp, and then I just round it a little bit. So yeah, you have to look at not only the antagonist, but what I see most of the time is also the neighboring teeth. Like they have also old fillings, or there is already some mesialization of the 7 or whatever. And then you have to adjust those as well to have a better emergence profile of your overlay or restoration that you're going to make.
Yeah, because I think that's something that young dentists maybe struggle with, you know, trying to work out why things are failing. So trying to cover some of these little tips that maybe will help you along the way. Shall we have a look at the next case? Because I really like this one. This is I think this is the first case of yours that I was alerted to, or it came up on my feed or something. Somebody shared it, I don't know, but this was a really good one. So can you tell us a little bit about what was the deal here?
This is quite an emotional case, actually, because the patient behind this tooth is the widow of a very good friend and colleague of mine. And so this restoration was made by her husband. And so it was already, I think, 4 to 5 years. I told her, okay, it's time to get it out. There are some secondary caries under there, and she was also a dentist, and she saw the X-ray, and she said, yes, it has to be done, but it's been made by my dear husband, and so she's been lingering to do it or not do it, and it was very difficult for her to take the step and really take it out, which made that by the time I got the chance to actually treat it, the caries was quite deep already, and it was really close to needing a root canal. And so yeah, it was a lot more work than I actually envisioned some years ago already.
Yeah, you can see, you know, in that central portion, the discoloration, where probably probes were sticking a little bit. I can imagine in my mind the probe is sticking quite nicely there.
Yeah, the distal part of that like puzzle inlay was moving also already, so I knew that it was going to be quite deep inside. And actually, she told me that there was only one onlay originally, and then it needed a reparation, and that's the second like puzzle piece you see there. And so yeah, it kept quite long actually, but now it was really just really deep caries. Once I just got the first piece out, I was already, oh my god, this is gonna be a deep one.
Yeah, yeah. Apologies, you can't see my face. I think you can just see my chin for some reason. I don't know why it's doing that. The first time it's done this to me, but I'm not sure how to fix it. But we'll carry through. So you've used caries detector dye again, and you can see how large that restoration was and where the caries has extended to. You can see the shadowing of the pulp on the floor of the cavity.
Yeah, I'll just, because I have some more pictures of this, I'll just
awesome.
try to show you how it looked like when just taking out the first part here. So I didn't see any margin here. It was completely gone. So I was, okay, where is this going to end? There's still some cement here for some reason, and here actually is some gold left as well. So the prep was done partly in this old onlay. Took the second part out. It seemed that there was also a crack here on the mesial, running further to the occlusal, and some, like you said, some darker dentin here as well. But like this part is just really completely soft. So it took a while to get to that stage where you're showing already this part.
Yeah.
And obviously, like here, I packed some Teflon, like I said earlier.
Why do you prefer Teflon?
I prefer Teflon because I think you can choose the thickness of the body you're packing more easy. Then the cord, and the cord has capillarity as well. So when it gets out a little bit and then it's like bleeding, then the blood will get out of it or on your preparation more easy, I find.
Okay, so it's for the moisture control as well as ease. Okay,
indeed.
Awesome.
It takes some while to learn to control the Teflon, but once you get it, it's quite nice.
It's worth it, yeah. And then you've lost quite a lot of that distal portion, haven't we? There, so you've had to do some dental acrobatics to get your matrix band in there, haven't you?
Yeah, like this matrixing is always a difficult one, isn't it? Because we've lost a lot of the dental structure that usually will give some support to the matrix. Yeah. So I had to be a bit more creative there to fix it, and so I used some flowable on the 7 to like grab onto the matrix. And then I packed again some Teflon from the distal of that matrix to make it really really snug fit in there. Only to the buckle, but there on the buckle it doesn't need some elevation, so just the distal part needed to be really nicely fit. Yeah.
Is that something that you do quite regularly to kind of hold your matrix in position?
Yeah, I think in these situations we always need some like creative thoughts, and those matrix acrobatics really come to to play in these times. And I think for me, I do it quite a lot actually, because I rarely use these circular matrices because it's very difficult to get them nice and deep. So I usually use these sectional matrices, which I take a very stiff one so that I can really push it with my finger into the deep.
Would that be like 12 VM or something?
This one is Lumicontrast from Polydentia.
Okay. Yeah.
Yeah.
There's so many.
Yeah, there's quite a lot, but I like this one a lot because it has the stiffness, and the contrast is really nice as well, because you have a lot of matrices out there that have like a kind of powder coating or something like that. And
Yeah.
when you try to push or adapt it with an instrument, then the coating comes off, it gets into your bonding or whatever. It gets quite messy. But this one is like really coated. It's not something that's on there. It's like the band is just really black, and so it never comes off. It's really clean, and like I said, I like the stiffness to really push it into the deepest part of the cavity. And even if you really go and condense the Teflon from the other side, there will not be like a bulging.
It won't deform. Yeah.
Yeah, it will not deform very easily.
In terms of the composite you use, are you using a flow here, or is it something quite heavy filler material? What's your choice when you're doing something along these lines?
So here I'm using two different composites. On the distal part for the enamel, let's say, replacement, I'm using a packable composite, which is the Filtech one.
Yeah.
I like it because it's really hard, and so you can really pack it. Once you've got a very stable matrix, then you can really pack it well into that box. And so this is my outer layer, and like you can see in the picture you're showing now, you can see that the Filtech one is not as fluorescent as the other composite I used, which is the Everex Flow.
Yeah.
And the Everex Flow is a short fiber reinforced flowable, and that one is very fluorescent, and so you can see a very nice difference between my dentin replacement material and my enamel replacement material.
Yeah, and what I really like about this case, one of the reasons I chose was you gave a few angles of the preparation. Obviously, we can see this is very similar to before you added the composite, but what is really nice is these two angles here where we can see the heights and the kind of change in the dome. It's almost the compression dome sort of technique, isn't it?
Yeah,
You
it
can
is
see how
actually the compression dome technique, and the non-retentive prep technique by Gianfranco Politano. So yeah, you just make sure that the margins are going to. I don't like to use bevel, but you're going to incline them a little bit like this, so that the occlusal forces will go into the tooth and not on the outside of the tooth.
Yeah, yeah. So you don't want the underlying structure to crack, essentially.
Yeah.
So you want the tooth force coming inwards, and you can see it's really nice how you've done there. Do you polish your preps? What do you do before you send them away? Anything along those?
I don't really prep it. I don't really polish it. The only thing I'll do after I added my last layer of composite is make sure that it's quite flat, that there's no sharp edges. And mostly I'll add one last layer of flowable. And then it will be a flowable that will be able to level itself. So I like to use or SDR from Dentsply or bulk flow from Filtech 3M. So these, when you apply them all over the surface, except for the enamel, then it will level itself out, and you will get a very nice and smooth prep just by the leveling out of this flowable. And so at the end, the only thing I do is just take away any adhesive or flowable from the enamel. And usually I do it all with a fine diamond, all with a brownie. And then this just gets this very smooth surface.
Yeah, really, really good. So I'll take that off now. My hair looks terrible, but here we are. Yeah, and those are really nice preparation techniques to look at, and it saves a lot more tooth tissue, doesn't it, than doing the old school wraparound prep for PFM crowns or full metal crowns.
Well, the way I work is always just removing everything that's bad in the tooth and then have a look at what's left of it. And having a look at what's left of it, I always ask myself, is it strong enough to stand by itself, or is it strong enough if I reinforce it? If it's not, if it's neither one of these, then we have to lower it by 1.5 to 2 millimeters. But if you just start by thinking, okay, I have to prep all around, then you're not having any thought about what's left of this tooth structure. So what I'm doing today is really having a look at the tooth, what's left, what's being able to still stay there, and what has to go. And this way really saves a lot of tooth structure, I think.
Can we talk a little bit about the bonding protocol you have when you're delivering your final restoration? I think that's something that's there's a lot of different kind of talk around this subject. And then if you have any tips for younger dentists around occlusion as well, I think that's something that people are constantly asking me to get somebody on to talk about occlusion. So if you have any little nuggets there around onlays and bonding and posterior work, that would be nice to hear from you as well.
Yeah. So I'm always luting my overlays now with heated composite. So it's actually a very easy protocol, because you just use whatever adhesive you're working with. The only thing you should do is really know how to prepare the tooth that you've prepared, and how to prepare the intaglio of the preparation of the restoration you're going to place. So I think 95% of the restorations I place is lithium disilicate, Emax.
Yeah.
And so it's already pre-etched by the lab. And what I usually do is I pre-fit it in the mouth, because before I put the dam in there. Because at that point the teeth are most like relaxed. They are not under the tension of the rubber dam, because sometimes the rubber dam also has the tension of pulling the teeth to the mesial, and then when you try to fit the overlay in there, it will sometimes not fit anymore, or it will be very snug. So if I know beforehand that it fits well in the mouth, then it will surely fit afterwards as well. And if it's too tight with the rubber dam on, then I know I just have to wedge, or I have to relieve this tension from the rubber dam. And so after that, of course, there's going to be some fluids on the rubber dam, on the restoration, right? So I put some phosphoric acid again on the inside of the restoration, and then I use the veneer me from Sta Italiano.
Yeah.
Which I then put 5 minutes in the ultrasonic bath, so that everything comes off of the Emax. And once it gets out of there, I put an extra layer of silane on it, and I put it in my composite heater, so that it gets the same temperature as my composite, which I also put in there. This is just a restorative composite. And the tooth itself, I sandblast it, I air braid it, and then I just also put phosphoric acid all over it. And then I'm gonna turn the camera again. Then we get to this point. So you see that the inside is sandblasted again. The outside, the enamel, is nicely etched. And then I just put my adhesive. If you're using two-step or three-step adhesive, then just the bonding should be enough. I always like to use primer and bonding, because you never know, like this little space where the IDS layer will be a bit thinner. When you've aerograded it, it might expose the dentin again. So I always do the primer and the bonding again. But if you're just going to allude to the old composite or the enamel, then bonding on itself should be enough.
Yeah. Got a question from Carlos Dentist in Melbourne, Australia. He's asking, does this process not contaminate the edge surface?
Which process? The fitting in the mouth with the saliva and stuff, you mean?
I think for priming and bonding. Cal, can you let me know exactly which part you were asking around the contamination of the edge surface?
I think he means that the contamination happens when you put the restoration in the mouth the first time, and yes, it will contaminate the edge surface, of course, and this is why you need to etch again, but with phosphoric acid, not with hydrofluoric acid.
Yeah, and you put you put it in the bath as well, don't you?
Yeah, I put it in the veneer me, which is filled with water, and then it goes like 5 minutes in the ultrasound bath, so that any proteins that are left on the intaglio of the edge surface, everything is gone. Yeah, it's completely clean again after that process.
And then any tips or tricks for priming and bonding? He's asking. Great question.
Well, that's the difficult thing I was talking about in the beginning. Like priming and bonding is so technical.
Yeah.
Because if you're using a 3-step total etch technique, then the things they are saying always is the dentine after etching, it should be dry but not too dry, and it should be wet but not too wet. And so which is wet and which is dry, right?
Yeah.
And then after the priming as well, you have to rub it in for quite a long time, but you don't have to rub too hard, because if you rub too hard, then you can again make a collapse in the collagen network. So for me, this priming and bonding is a really complicated step, and if you use something that's very technical sensitive, like a 3-step total etch adhesive, yeah, you can make so many mistakes in every step. And so I like to simplify, and I use this universal adhesive, which will not be as technique sensitive. But you have to know, well, also if you're going to use a universal adhesive, that you're not going to get the maximum bond strength that you will be able to get if you do all the steps.
Your idea is you're going to make less mistakes, so you'll probably get a better result, because you're more likely to make lots of mistakes with a 3-step than you are a 1 or 2-step. So your bonding should be higher than the mistake levels.
Well, let's say that even if I make a mistake with a universal adhesive, which is quite difficult already, because the only thing you have to do is rub well for 30 seconds, right?
Yeah.
Because it doesn't matter if it's too wet or too dry, because it works in both situations. And so I will almost every time get the maximum bond strength, and more importantly, the maximum longevity of the bonds of the hybrid layer, especially if you use the IDS afterwards. So if you cover it with a flowable, then the hybrid layer will be nicely protected by the flowable that has had time to harden. And so most of the time I'll get the highest possible bond strength of the universal adhesive. But when I'm using a 2-step or 3-step adhesive, and I'm not with my 100% thoughts on the bonding procedure, then I'm sure that I will get some mistake in there. And I think the initial bond strength might be higher, but when you get some mistakes in this priming and bonding steps, there will be voids in the hybrid layer, and the hybrid layer might get pulled apart, and that's where the longevity of the bonding will fail.
Yeah, we've got another question from Lady Ruba. why is there sometimes sensitivity after composites?
Most of the time it's because of the polymerization stress that happens, and that the hybrid layer really getting pulled apart because of the following layer of composite going on there, and so it will bond to the adhesive, but then the hybrid layer will just be pulled apart by the composite that's on top of that. So even though it looks like it's fitting nicely on the outside, on the inside probably something is going wrong.
Yeah, and a lot of guys like to use a base layer of a flowable on top of their bond to alleviate that, don't they?
Yeah. So of course, if we're using a very lowly filled adhesive, then you need this flowable to protect the hybrid layer, and the best is to just leave it there for at least 5 minutes and let it mature for 5 minutes, and then you get at least 90% of the bond strength.
It's what I call cup of tea time.
Cup of tea time, yeah. I'm more of a coffee guy, but
yeah.
You're from the UK, so I understand the tea part.
Yeah, I have to have the tea, unfortunately. So, great question from Hammer Time as well. Do you prefer milled lysine over pressed, and do you advise any specific instruments to polish margins after fitting?
So milled against pressed. I used to prefer the pressed ones because I thought that okay, one, you'll get normally higher strength, higher fracture strength of the restoration, but that's not always needed. And two, you're gonna be able to get finer margins, and this is for like veneers and stuff like that. It's really important. But for these overlays, if you prep in a way that the margin is not going to be too fine,
yeah,
then I absolutely prefer the milled ones.
The milled one.
Yeah.
Awesome. How to, let's see, blow dry. Somebody saying blow dry excess dentin bond. Oh, they're answering the question from Lady Ruba. Somebody's asking what you're drinking.
I'm drinking Duvel.
And somebody else is saying their teeth were hurting and then we were live and it was Dentist Insta. So yeah.
So there was something about blowing the.
They were answering Lady Ruba's question.
Okay.
I think there was the second question from Hammer Time, which was, do you advise a specific instrument to polish margins after the fitting?
Yeah, just a very fine diamond burr. I always leave like a little bit of excess of my heated composite, so I do a final push and then a little bit, really like a really little bit of the heated composite will still come out, and that I leave there. So there's always a little bit of excess. Only in the proximal, I take it away with some floss or whatever. But on the buccal and the lingual surfaces, I always leave this like bulging out kind of heated composite so that I can polish it away afterwards. And this I do with a fine diamond, and afterwards just with your favorite rubbers. You always use, or wheels, whatever polishers you use, because there's also so many out of there. What I use is the I like to go over it quite quickly with a brownie, and then I just use the wheels from Soflex 3M.
Composite and subgingival margins. I think this picture is a really good example, Endoman. I think the main thing with composite with a subgingival margin like this is making sure it's bone dry when you're placing, isn't it?
Yeah. So the key here is really isolation. So if you can isolate it, you can put composite. It's as simple as that. If you can't isolate it, then do some crown lengthening beforehand, and then try to isolate it again. But if you can't get it dry, then don't use composite.
Yeah, perfect. Fazan's asking what country you're from.
From Belgium.
From Belgium. And any advice on how to capture subgingival margins with impressions?
Yeah, well, usually in the posterior, I don't do subgingival margins anymore, unless there was already a crown prep there, and it's really like 360 prep that you can't really do.
Crown thing or something.
Yeah. So double chord technique is the only real thing that works. So you put one smaller chord in the deepest part, and then a thicker chord above that, and just before you start the impression, you take out the thicker chord. It works on conventional impressions and digital impressions.
Yeah. Some guys that are doing the impressions digitally with the scanner, you know, with the dam on, which is really impressive.
Yeah.
I quite like that, because you're getting, especially if you use a heavy dam, you get some pretty strong retraction.
Yeah, I do that quite a lot as well, actually. When I have the right scanner, because with my simple scanner I can't cut out or block like spaces, and then it's quite difficult. But when you have a good scanner, you should really try the rubber dam scanning. But like I said, you have to see the margin before you can scan it, and then most of the time, like someone answered as well, you should try to elevate the margins wherever possible. And then it will make your life so much easier.
Yeah, Endoman is saying deep marginal elevation. I think that was in reply to when we were talking about isolating, you know, composite for the margins. I think that was what we were talking about there. Fazan's now talking in Dutch.
Ja, ik spreek Nederlands, Fazan.
Lady Ruba's making comments about, I think, probably you. Let's see. Any other questions, guys? There's been some really nice cases, man.
Thanks.
Let me just recap them for the guys who maybe didn't see earlier on. Just have to scroll back. Do you trust the bond between resin and your indirect?
Yeah, absolutely. If you treat the composite in a good way, which is just air abrasion, and then you're bonding, then you're safe. If it's an older composite, I would use maybe trip chemical coating, which is like the cojet sand, cojet air abrasion, and then silane coating. But you're absolutely safe if you know how to bond to the composite.
Yeah. There's the case, second case that we looked at, and where's the first one? Let me find it again. Here we are. There's the prep, and then the start was a mishmash of different restorations. Any other questions, guys? We've taken up quite a lot of Valentin's time. So I think we're probably.
I maybe give one last tip, because you were showing the indirect the provisionals again, and so when I did under the rubber dam, or I plan to do it afterwards, I always put these tags already with the rubber dam on. But in this case, afterwards, I saw that the opposing 6 was like really falling into this space, and so I had to stop that as well, because if you don't do that, this one will erupt further and your overlay will be in over occlusion afterwards. So I think if you see that there's nothing supporting the antagonist, then always place something that will retain it as well.
Really important tip there, because you don't want to come there and then realize you've got 0.5 mil less space than you thought.
Yeah, and then you have to like cut it off again.
Yeah. Guys, big thank you to Valentin. Make sure you're already following him if you're not already. If you just joined us now, the replay will be on YouTube. It won't be on IGTV. So you can head over to the link in my bio to check out the YouTube channel, where all the replays of all the IG lives that we've done are on there. plus some podcasts with different dentists and some non-dentists as well as a series on how to use Instagram for dentists. So there's a whole load of stuff on YouTube if you guys haven't seen it already. Also, we've got a giveaway with loads of stuff which is going on right now. We've got a suture kit, training kit for dentists. We've got some loops which we're giving away, instruments, whitening, and a few other things which we haven't announced yet, but as we get to 50k on Instagram, I'm going to be announcing more and more of the gifts, so make sure to join that, guys. And yeah, most of all, make sure to head over and check out Valentin's work. Where else can we find you? Just on Instagram or elsewhere?
I'm on Instagram, I'm on Facebook, and we just launched with some friends a new learning platform where we will introduce some courses in Belgium. For the moment, we are just doing courses in Dutch, but we are certainly planning to do some international courses as well in the future. And so go check out as well Dental Bootcamp. If you search Dental Bootcamp in Instagram, or Dental, how do you call it? Is it a hyphen? Dental hyphen Bootcamp, or
is it a dash or a hyphen? Is it in your bio? Can they check in your bio?
It should be in my bio, yeah.
That's the best place to find it, guys. And thank you for doing this, by the way. I know English isn't your first language, and I'm always very pleasantly surprised how well people do when talking to, you know, people with funny accents from England. So big thank you for that. Guys, been a great pleasure. Big thank you to Valentin. Make sure to go follow him. Make sure to check out all the bits I just spoke about. And if you haven't already, make sure to follow Valentin, like we said before. We'll be back soon with more cases and more podcasts on YouTube. So make sure to check that out and subscribe if you haven't already.
Great. Thank you. Bye.